For the first time, the federal government is prepared to negotiate with pharmaceutical companies over the price of some very popular drugs under Medicare. This is part of President Biden's plan to lower prescription drug costs, part of the Inflation Reduction Act passed by Congress last year. Weijia Jiang joins us now from the White House with more on this. Weijia, good morning.
Good morning, Tony. Good morning to everybody. You're right. This fall, the agency that runs Medicare will start haggling to get a better price for 10 widely used medications. But critics, including lobbying groups and Republicans, are fighting the negotiations. There are at least 8 lawsuits aiming to block them.
Catherine Bristol's diabetes medication costs up to $200 a month. She says sometimes that means she can't afford to buy groceries.
I shouldn't have to choose between my medicine to keep me not going blind, not eating, or dipping into my rent.
Bristol takes Januvia, one of 10 drugs that could be cheaper after negotiations between the government and drug manufacturers. They're used to treat a range of illnesses, including heart failure, blood clots, and arthritis. A new report shows about 9 million seniors in Medicare's prescription drug program used one or more of the drugs last year, paying $3.4 billion out of pocket.
We're going to keep standing up to Big Pharma, and we're not going to back down.
President Biden announced the plan for price cuts as part of his inflation reduction plan. But the top pharmaceutical trade group, Pharma, called it short-term political gain rather than what is best for patients. Pharma has joined the legal battle to block the program. The White House insists it has the authority to move forward.
Medicare's ability to negotiate drug prices is clear in the law.
Newly negotiated drug prices are set to be released next year, with lower prices going into effect in 2026. Bristol says better late than never.
It's about time that the medicine becomes available to people, that we can afford it.
Drug companies have until October 1st to agree to enter into negotiations. Otherwise, they face an excise tax of up to 95% or will be forced to withdraw from Medicare and Medicaid altogether. Prices for additional drugs are expected to go down in the coming years. Tony.
Weijia, thank you very much. This is kind of a big deal because Medicare is a huge part of the federal budget. We are all paying for it with our taxes.
Right.
But what Big Pharma is saying on the flip side is also interesting. They're saying we need this money in order to keep innovating. So, time will tell who's on the better side of this. But
Right.
it's a big move.
But consumers just want to pay less for the drug.
Absolutely.
At the end of the day,
At the end of the day, that's all anybody cares
That is
about.
exactly right.